Welcome to Danish-InfoNews TV, your Danish English special report. This special report is about drug use trends and public health response in Denmark 2025. Today we take a closer look at a silent crisis affecting Denmark's youth. Opioid and cocaine use. New studies and public health data revealed alarming trends that demand urgent attention. Stay with us as we uncover the facts, hear from experts, and explore what it means for our communities. Opioid use amongst youth surprises experts. A new study reveals alarming patterns in opioid use among Danish youth, surprising researchers and healthcare professionals. According to the peer-reviewed study published in the Danish medical journal, 85% of young individuals who try opioids return to using them again, and many start at an early age. The study involved anonymous responses from 1,222 individuals aged 13 to 26, of whom 298 reported having used opioids. While researchers emphasize that the sample is not representative of all Danish youth, both Jacob Thomsen, senior author and physician, and criminologist Henrik Vai agree that the findings are significant and concerning. 2/3 of the users tried opioids before the age of 18. Among those who have used opioids, 85.9% used them more than once and 17% reported daily use. The study was conducted by Antidote Denmark, a public health organization, and data was gathered through QR codes on posters, social media, and distribution to all youth education institutions. The researchers highlight the study's value in shedding light on a highly taboo subject, suggesting a significant hidden population of young opioid users. Cocaine use evident in wastewater, new data from June. June of 2025, another dimension of drug use in Denmark came into focus through wastewater analysis. For the first time, Denmark joined the pan-European monitoring program with results from 6 cities: Copenhagen, Aarhus, Aalborg, Odense, Esbjerg, and Næstved. The findings reveal widespread weekday cocaine use, an unexpected development. Christian Lindholst, head of the Department of Forensic Medicine at Aarhus University, led the analysis and expressed surprise at how much cocaine is consumed during the week. In some cities, such as Næstved, the difference between weekdays and weekend usage is minimal. In Copenhagen, daily usage is high and stable with weekend spikes. Since 2013, measurements in Copenhagen show a consistent rise in cocaine residues in wastewater, from 218 mg per 1,000 inhabitants per day in 2013 to 548 mg in 2024. Furthermore, the Center for Drug Research has reported an increase in the number of people seeking treatment for cocaine addiction. In particular, among men over the age of 26, there is a noticeable uptick. Christian Holte Koful, supervisor at Utern, Copenhagen Municipality's drug treatment service, describes cocaine as the most physiologically addictive drug. The rise in cocaine use correlates with record seizures in Denmark, 2,357 kilograms in nearly 5,000 cases in 2024, according to the National Unit for Special Crime. Europol warns that increased cocaine availability in Europe brings significant social costs through health impacts, crime, and violence. Opioid packaging near Aarhus School sparks naloxone debate, May 2025. May of 2025, concerns escalated when packaging from opioids tramadol was found near a school in Aarhus. The school board discussed the potential purchase of naloxone, an emergency antidote for opioid overdose, to be kept on school premises. According to meeting minutes obtained by TV2 Østjylland, the school considered this precaution even though no substances had been found on school property. Ultimately, they decided against purchasing naloxone after consulting a pediatrician. who advised against keeping the antidote on site and recommended contacting emergency services in case of an incident. School principal Lona Grisson affirmed that no students had been affected and that the packaging was discovered only in a nearby residential area. She emphasized the school's decision to follow medical guidance. This local incident reflects a broader trend. Earlier in 2024, data revealed that 23% of young people aged 15 to 25 in drug treatment had misused opioids, the highest proportion on record in Denmark. In Aarhus, the figure rose to 35%, far above the national average. Conclusion: addressing a growing crisis. Across both opioid and cocaine use, trends in 2025 underscore an urgent public health challenge in Denmark. Young people are experimenting with and becoming addicted to dangerous substances earlier than expected. Wastewater analysis and treatment center data indicate growing usage patterns, not just on weekends, but throughout the week. Experts call for targeted education campaigns and stronger harm reduction strategies. Jacob Thompson stresses the importance of getting accurate information to youth who are increasingly exposed to these substances. Henrik Vai agrees, urging that campaigns be refined to reach the right audiences. Both experts and law enforcement officials warn that the increased availability and potency of these drugs are fueling more frequent use, higher addiction rates, and, in tragic cases, fatalities. In 2023 alone, 17 deaths were attributed directly to cocaine. Let's look at why substances like opioids and other euphoric drugs are dangerous, especially for young people. Increase in risk of addiction. Strong physical and psychological dependency can develop even after short-term use. Brain adaptation requires higher doses, increasing overdose risk. Withdrawal symptoms can be severe and discouraging, trapping youth in cycle of use. Life-threatening overdose. Opioids depresses the central nervous system, potentially halting breathing. Combining with alcohol or sedatives increases the risk dramatically. Harm to the developing brain. It causes disruption to memory, concentration, learning, and problem solving. Potential to trigger or worsen anxiety, depression, and psychosis. Physical, behavioral, and social consequences. Organ damage, nausea, constipation, and respiratory issues, irritability, social withdrawal, poor school or work performance. It also leads to relationship breakdowns, social isolation, and involvement in crime. Easy access to social media can create false perception of safety. The Danish public health and education systems are now faced with a critical window of opportunity to act on these findings with evidence-based interventions that can reverse the tide before the crisis deepens further. You've been watching a special report from Danish-InfoNews TV. The growing prevalence of opioids and cocaine among young people is a wake-up call for public health and education system. Awareness, prevention, and timely intervention are more important than ever to protect our youth. Thank you for watching and stay informed.